Aho, kitipilo hele, yesipi yayani, lasawanwa.
Hello, and welcome to Among the Shawnee, a podcast for absentee Shawnee tribal members. I'm your host, Mindy Longhorn, Media Director for the Absentee Shawnee Tribe. Hello, everyone. Today we are going to talk about several community outreach programs and events that the AST Public Health Department is involved with. And joining us again, Rita Hunnicutt, registered nurse. We've got some newcomers here, Jayden Watson, Community Health Outreach, and Terra Jim, Community Health Aid. Welcome to the show.
Thank you for having us.
So we're back.
Yes,
You're back.
yes.
So you've got some more public health events.
So we're hoping to share some up and coming and kind of what we're going to hopefully do for the next year or so.
What do we want to start with? Which event are we starting with first?
Okay, so I think I'm going to have Terra talk about some of our elder events and different programs that we have that will help our elders and hopefully get them the resources they need. So
Okay, we'll start there.
So we have what's called the Elder Fun Days. We do various activities.
What day is that?
Those are on Thursdays.
Thursdays. Okay.
And we switch back and forth to Little Axe and Shawnee. We also do like various arts and crafts, and we have shout outs and announcements on that whenever it's available. The elders seem to really like the bingo. The bingo is a
Probably pretty competitive too. If you've ever been to an elder bingo, yeah, you know.
like that is one of their top
That's their
ones.
favorites,
Yes.
yeah.
And then Sienna, she got some games, and they've been doing games, and Jayden, whenever he comes, he talks about like the fitness and heart health, and we'll have nurses that come in and talk. So it's just basically, because our job is to advocate for the public and to educate them. So
Right.
that's what we're trying to do, along with having fun. Sienna is an amazing caregiver coordinator. She's been a blessing to this clinic, and I am so honored to be able to work with her, with the elders, and this whole team. But I feel like 2026 is going to be our year in public health.
That's great.
And I think that the elders are going to be really pleased with
Good.
the next.
That's good because we want to take care of our elders.
Right, right.
I mean, they're esteemed. What time do these events on Thursdays occur?
So they start normally at 11 and they go to 1 o'clock. Sometimes we start a little bit after 11, just depends on whenever they get done eating. We normally let them eat first, and then we get the activity started.
Okay. So this is in concurrent with the Title VI meals.
Yes. So
Yes.
as Title VI is out delivering meals to elders, and then as they do meal service at the Little Axe Resource Center, and then also too at the Title VI building at over
Complex.
by Finance.
Okay.
We will go in about every other Thursday, and we will do the Elders Thursdays Fun Day. And also too, once a month we rotate sites. So in March we will be at Shawnee location, and we will do a cooking demo. And the cooking demo is fun, easy to make, low cost recipes that anybody can do. And
Do you get samples?
Oh yeah.
yes, we do actually. Yeah.
And usually we have quite a bit left over too.
Oh, so you get to
everybody
take
can-
something home,
Yeah.
maybe?
Yeah,
Okay.
sometimes,
So
yeah.
come on out. Now, does someone have to be a Title VI participant, or could they just show up? Would they buy their Title VI meal if they wanted to just partake in that?
So yes, if you want to just come out and hang out, you just $5 a meal from Title VI if you're not signed up with Title VI as an elder.
Okay. So there's some people that may not.
Yeah.
But then that way they could still enjoy the activities, cooking.
Yeah, so the resources and some of the activities will of course go to the elders first, but and they'll be directed towards what what they may be more inclined to need. So it may not be for everyone. But as far as the cooking demos and as far as like any arts and crafts stuff, if we have, it available to share, we can always do that too. So if we try to make it as accommodating to everyone as we can, but it is geared towards our elders.
Right.
Yeah.
As it should be.
Right.
I mean, obviously.
And I feel like the elders have really taken a liking to the cooking demos. Like
Really?
very much. They're like, okay, when's the next cooking demo?
They like to critique those.
They're probably like, let me get over there. And cook that for
They're like,
you.
wait a minute, we can't use salt? What? No, we need salt.
So
on that.
they're healthy cooking. Okay.
Yeah.
So you're not cooking with grease or it's healthy.
Yeah.
Okay. But it's still probably fun, I'm sure.
Oh, definitely.
And there are recipes that you can find in food dipper programs, so food distribution programs on Indian reservations. You might get in commodities, so foods that you can find in there, you can make. And also, too, for participants who are on SNAP, so Supplemental Nutrition Assistance Program, foods that are easily available for SNAP recipients as well.
It's really neat. So.
And it sounds healthy.
Yeah. And,
which we all need.
Yeah.
Okay, so that's for the elders. Those are geared for the elders.
Yeah.
They're fun days, which are Thursdays.
Yes.
Okay. Anything else for the elders coming up?
I think that Sienna has purchased some materials to make a blanket.
Okay, so
And
that's coming up too. Okay.
And that's made with the really thick yarn. So you just use your hands for that. You just loop everything all together, continuous, and it's just one giant blanket. And
Sounds
also,
easy.
too, in the past, we've learned how to bead ornaments. And so we've beaded ornaments with the elders as well. They've loved that. We've gotten to take it with them as well. And so I think also, too, coming up in the future, we are going to play some board games with them. Just let them kind of have a fun day, like Uno,
We found that they were
checkers.
pretty competitive, so we've kind of geared a few things to do that with too. So,
fun.
so if it's not arts and crafts, we usually try to do something either arts and craftsy at least, some cooking demos. We try to not just always do one thing or another. So, Sienna has been amazing at that, of finding resources on top of games and different ideas to keep everybody very active in what we're doing, so that it's not just the same
thing
each
every single time they come. They might get bored. So.
Right.
Okay.
Well, I think anyone would if it was the same thing over and over.
And even whenever we had to reschedule due to weather, they would just like we would call them and let them know, like, hey, I'm so sorry, we're gonna have to reschedule.
Right.
And they're like, man, I was so looking forward to this. And I'm just like, I'm so sorry.
They're snowed in. They wanted to come.
Yes.
It's like,
But that's good. That's great that they want to participate.
And we do also reach out to different departments and different individuals to come out and speak about different health topics that we might want to cover, that we might not.
Not in your wheelhouse. Like some other health department come out and talk about.
right.
Okay, so we've touched on the elders.
Mm-hmm.
What else are we talking about that you've got coming up? I feel like there's a lot.
So yeah, we have a lot.
I know you do.
So I do kind of want to just kind of hit on, and if I get some things, because this is kind of we're really covering for Sienna today, because we know she had a lot of stuff. Yeah,
sick child.
So I do want to just reiterate that she does still have the caregiver grant, and she does still do those events. Please look out for any kind of caregiver things or any kind of we always put them on. We try to send out everything. So we try to get everything on Facebook. We try to get everything on posters. If you're even, we also do respite care for our elders, which is where Sienna has a program that if you need help with respite care, we can offer help with that. You would just go ahead and just call the clinic and ask for the public health department. We can direct you wherever we need to talk on that.
And set that up for them.
So yeah. So we also have elder cares where I know she'll call and check on them. I know Terra does a lot of calls, the ones especially that are living by themselves. We want to know that, if you feel like you want someone extra kind of looking after them or helping you look after them, we've done phone calls. We've done like quick trips out just to see if they're okay, making sure that they're set up with the resources they need. Like if they need someone to bring them food, we set them up with the title, and we do all that kind of stuff. So I just kind of wanted to, make sure that we just kind of noted on all that stuff that we still have available, that, we have plenty of room for anyone that may think they need any of that. So I do, just kind of let people know that, really wanting to kind of get out there and help as many as we can. I think Santa's also set up where some ramps have been done, and just different things
Little
like
things
that.
like that.
Yeah,
Just kind of go out and maybe see what the need is.
It's like if
Right.
I can't really go over like everything that
Right.
because we have so many resources. But if you're an elder or you're taking care of your elder,
or if you know of an elder,
or
maybe
an
needs
elder that
checking
needs
on.
resources,
Right.
we
Okay.
have all kinds of. And a lot of times, if we can't get it, then we do try to find someone that does have them available. So I just kind of wanted to make sure that that everyone kind of knows that we have that now, and we're really taking
I think that's wonderful.
Yeah, thank you.
Yeah, so if we can't directly help the elders with the resources that we have, we do go advocate for them and try to bring the resources to them
Okay.
and
Yeah.
connect them.
I think that's great.
Yeah.
I feel like we try to treat the elders like they're our Mima or Papa. Like we treat them as, it's crazy how you connect to them, and you need to be able for them to trust us, and you have to build like some type of relationship with them. And I feel like it's just been, the elders they're amazing. They're amazing people.
I agree.
It's been a truly, I would just say, eye-opening and awesome opportunity for sure.
Well, I think it's great that you're looking out for them, because they are definitely very esteemed, and they're like up here at the top.
Yeah.
I think it's great.
Yeah. So thank you very much for that. So I guess I'll just go ahead and go over some of the stuff that I've been doing. So I'm still doing the car seats.
Oh, so we're going from elders to babies.
So we are literally, yeah. So we're going to jump the fence now.
Let's just let's just go all the way to
yeah,
babies.
we're public health. We take care of our most vulnerable population, and right now that those are two of the most vulnerable populations that we have. So we do kind of tend to focus on those areas.
Nothing wrong with that.
So we are doing another car seat event. This one has been scheduled for May 14th.
Okay.
It's going to be from 5 to 7. And we will start hopefully putting out flyers in March. And the flyers are the one thing we are doing different this year than we did last year is we are going to make them by appointments.
Oh, okay. Is that because you had a lot of people probably?
So, yeah.
So
the last one really, I knew there was a need. But really until you get and you start having events, you really don't know how big the need is until you get that. I think we ended up with almost 30 cars at the last event.
Okay.
And we had we gave around 20 seats out, I believe.
Wow.
And 4 of them were because a lot of them was because the child had grown out of the seat,
Right.
or the seat they didn't know where it had came from.
Like
but
garage sale or
sale or something
right,
like
someone
that. And
gave
those
it to
are
them.
those aren't safe.
No.
We went over that last time, but but we also had 4 that had been were really unsafe. They were had been recalled. The straps were barely hanging on.
Goodness.
We had quite a few that we gave out. And so,
But that's great.
Yes.
Because car seats are not cheap.
Right. Right. And they really aren't. And it's so crazy. And then they're, now there's so many to choose from. There's so many different things. And we kind of make that simple. So we did do the last one in Little Axe. So this one will actually be in Shawnee. So we're going to do it in our Shawnee area, actually over here, just behind this building, actually.
Oh, okay. We're in the main building.
Yeah. Oh, sorry. Oh, yeah. By the way.
We don't know where we're at. So we would probably
We're going to have it at Title 6.
Yeah.
Oh,
So
okay.
it'll be back there behind Title 6.
Okay.
And we'll have stuff set up. We are going to, again, do the May 14th, 5 to 7.
Okay.
We're going to have a QR code on the handout that we receive. So I will have to get with you and do a new handout.
Okay.
But we're going to have a QR code, and we're just going to ask people to, it's just a few questions. They just open the QR code, they open it, they answer a few questions, and they get set for a time. We have teamed up with the Absentee Shawnee Tribal Police.
Okay.
And the Potawatomi County Health Department this time.
Oh, okay. Instead of
Right.
Cleveland, because we're not in Cleveland County this time.
So we've
Okay.
switched health departments, and kind of the area. So, but we're hoping that some of the stuff that we had hiccups last time was it was really hot, one, but it also we found that people were kind of caught in certain areas and had to stay longer than they actually had to stay. So we're hoping this time by doing appointments that, you know, we won't have a backup of people like we did last time. And we also have a couple of new certified technicians because Terra has gotten her car seat certification, and so has Jayden.
Okay. So you can serve more people then.
So yeah.
So
And then we actually have, and then Dave, who is back in the office, he's holding down the home front for us today. He also got certified. So we actually have like 4 technicians now.
And you'll be on site that day.
And they'll be on site that day. And then we also have the Pottawatomie County, Cleveland, or the Pottawatomie County, sorry, the Pottawatomie County is going to bring a few of their technicians too. Okay. So we should have plenty of technicians. We do have car seats available for if they are considered unsafe or your child's grown out of them. We will have car seats available.
What if you don't have one at all? Maybe you're expecting.
If you're expecting, that's fine too. Okay. We just please, we're going to do expected parents, and we are changing a few things too. Also, we're going to need the child to be present this time because we found a lot of people didn't bring their children, but we just felt like that situation was a little, that we felt it safer when we can actually measure the children and fit them into the car seat. So we're requesting that the child be present this time too. That makes sense. Mm-hmm. So yeah, and
we are doing appointments, but also too that doesn't mean if you don't have an appointment you can't come. You can still come because we are trying to
make it run smooth. But if someone found out at the last minute, you're not going to turn them away.
Or if they saw the flyer without the actual QR code, you know, and because you know, we know that things happen and life gets busy, so we're not gonna, you know, I'm not gonna turn anyone away,
right? Because every child needs a car seat that it works and that's legally that's important too. Mm-hmm.
Well, I just wanted to say that whenever Jayden and I went to the car seat training, I had more bruises on my legs when I came back from getting, I mean, shout out to the parents that strap these babies in. And not only that, but the tether in the back of the truck. Oh, my Lanta. I don't know what they were thinking whenever they did that, but it is not easy to strap somebody in a car seat. And when Jayden and I did it the first day, we had to videotape ourselves. And
do we have a video here today? No.
I might can share that with y'all later.
Okay, that would be fun.
So no lie, we were like, you know what? It's fine. The base, we don't need the base. It's fine. We're just gonna strap and Jayden was like, you know what? Forget it. We're just gonna put one seatbelt on one side and one seatbelt on the other side.
I would just like to know that that's the first day of their training. They did complete the training.
Okay, I was like, we want people to come to this event.
I was just saying that it was the training was an adventure. But
yes, whenever we found out we were gonna go be certified technicians for car seats, it was, these are car seats. They're simple.
How difficult can this be, right?
Buckle the child in there. Like,
you just don't want them to fall, right?
Right, it's
and
a no-brainer.
We went to a 2-day training, and just in that 2 days, we learned so much about all the different types of seatbelts, all the different makes and models of cars, all the different makes and models of car seats, and just all the policies and regulations that go into it. And you have to look at the manual of the car seat, manual of the car, and make sure everything is all okay. And there's just so much that goes into it that just like, wow, we didn't know.
Yeah. But you're certified now.
Yes.
Yeah. So wear your knee pads and everything. Hopefully you're going prepared. And you're certified too. So pretty much the whole team, it sounds like, that will be there.
Yeah. And I think that's pretty much it. I do want everyone to be on the lookout in the next couple of months. I am starting a new prenatal education program over at the Little Ox Center, and it'll be available for the patients in Shawnee also. It will be a home visit program, and so I'm really, really excited about starting that. But I'm not going to go too much into that because we don't have all the details on that. I just want everybody to look. That's coming soon, and hopefully get that started too. But I think the rest I'm going to have Jayden go ahead and go over some of the stuff he's been doing since he's joined our team.
So yes, as we just talked about earlier, we do have those food demos every month, and we just rotate sites between Little Ox and Shawnee, Title VI sites. And then also too, with the car seats at Little Axe building block site. So building blocks 3, Terra and I and Rita, when she becomes available, and we don't take away from her job duties, she's going to be able to help us at Little Axe building blocks 3 for parents who are wanting to schedule an appointment so we can go and talk to them about their car seats and fit their child properly in the car seat as well.
good.
And if they need a new one, then we might be able to get them one.
So it'll be like more of one-on-one appointments for
The building blocks.
for the building blocks
participants.
Mhm,
Okay.
parents. Yeah.
And that will be every second and third Tuesday of every month. And the second Tuesday will be from 12 to 4, those appointment times. And then the third Tuesday will be from 2 to 6 p.m.
So if someone's working, you're still accommodating. Okay.
Yeah, we're
That's
we're really hoping that this gets started in a really good, grand way. So
That's good. Then all the kids are safe.
Yes.
And then going back to the cooking demos as well, keep switching up.
You're in a lot of stuff.
Yeah. So we have partnered with AST Housing as well. So we also do cooking demos at different housing community sites as well.
Okay.
Yeah.
And so we just had our first one in February. That was at Bob White Community Center in McLeod. And our next one will be in March. It will be at Rolling Hills Community Center. And then we're going to switch over to Camac Circle going into April.
So you're doing that every month at different sites as well. Okay.
And it'll be the same recipe that we do with the Title VI participants as well. So we do one recipe 1 month at a time. So
That makes sense.
It's all the same.
Okay. So if somebody really wanted to, they could just go hit them all up. I mean,
we've had that.
I
We've had
mean,
them
yeah.
do that actually.
okay.
So,
and I want to know why you didn't bring samples.
Oh, we
Why
should
are we
have,
not
yeah.
having
Yeah.
samples
Oh,
here
we should
today?
have. We didn't think of that though. I guess.
Next time, bring
Yeah.
some samples. Okay. So you're doing a lot as well.
And then also, too, we have the Native Youth Preventing Diabetes Coalition that we are members of as well. And so I became the vice president of Native Youth Preventing Diabetes back
That's the
in October.
NYPD. I like
That's
that
it.
acronym.
I love it.
I saw
love
that.
It.
I was like, what are they doing with the NYPD?
And
Yeah.
I remember when I first started working with diabetes department back in 2019, and I first heard NYPD. I was like, why are we working with New York Police Department?
I was like, do you know where we're located? We're not anywhere
Every
near
time
New
he
York.
says NYPD, I think like the Criminal Minds like
Yes.
theme song comes in my head. It's like, oh, okay.
So what are you doing with the NYPD? It just seems funny to say that.
NYPD, we will be helping with Day of Champions. We're going to be providing materials for them, such as T-shirts, and then also, too, we're going to provide some staff to go out with the Day of Champions camp as well. That's coming up.
That's coming up. I think I was going to say June.
Yeah,
Okay.
June.
Okay. So what else is the NYPD doing?
So NYPD, we have our upcoming summer camp also in July. It's just a 2-day camp where it's only in the day camp. And so
Okay.
we'll have participants sign up for that youth, and we'll work with them, just teaching them about type 2 diabetes prevention, some other health topics, and physical activity, games. So they'll come out and be a part of that.
Okay. And NYPD, if someone just caught the tail end of this, stands for...
Native Youth Preventing Diabetes.
Okay, I think we need to get that out there.
Right,
We're not
right,
talking about New York Police Department. So it's just funny when you say that. So anything else coming up that we didn't touch on?
I think another thing, too, is March 28th, we have the caregiver event going on, but also, too, March 28th, it's going to be at the Well in Norman, Oklahoma. We have an individual who is also an NYPD member from Chickasaw Nation, and she works to make ribbon skirts and ribbon shirts for foster youth. And so we have collaborated with her and partnered with ICW so to where on March 28th, she's going to get a group of individuals together. They're going to make ribbon skirts and shirts, and those will be donated to the ICW foster children.
Very nice.
Yeah, we've got, like I said, we've got a lot more going on.
busy.
Yeah, we got
You're
a lot
busy.
more stuff going on, and we've teamed up with a lot more other stuff. Truthfully, if you you're interested in anything, and if you have any questions, you can always just call our department or come by. We're down at Little Axe.
And you don't need an appointment, right? They can come
No.
see you. I know we hit on that last time.
Yeah.
So if anyone wants any more information, they can
Yeah.
come see you in the
Yeah.
Little Axe Health Center.
They can buzz the doorbell, and I'll be
Okay.
right there on
Yeah.
the front
Or they
desk.
can call you 447-0300.
Yes.
Is that right?
Yeah.
Or asthealth.org.
Yes. So we try to hit like all. We try to put all our things on. All the flyers. We have them all. We try to like put them up as many places we can. Facebook. Website. We
newsletter.
We do the calendar on both websites. And we add to those too. So
Okay. So it sounds like you guys have lots of events coming up, programs. I just feel like you've got so much. Is there anything we didn't touch on before we close today?
So we actually do partner with the education department in their youth soccer program that they have out at Little Axe School, right next to the field by the football field.
Oh, okay.
And so that will start not too long after spring break ends.
Okay.
And then
So
the season
March.
runs, about March, maybe
March,
23rd.
Okay.
And the season runs through from early April to the first week in June. And so that's for 3 to 18-year-old boys and girls can sign up, and they're currently signing up right now. And so if you want
sign-ups are going on.
sign up, you can contact Blake Goodman in the education department.
Okay. Anything else that we didn't touch on? Is there anything else that you're doing?
I mean, yeah. So we always got stuff going on.
I feel like it.
Remember that we will have the backpack event coming up in July.
School's not even out yet.
I know. Okay, so I'm just trying to remember.
Whoa.
Yeah. I'm
Okay.
sorry. We're just trying to
No.
remember everything we still do.
Right. That's something that to be on the
yeah.
lookout for,
Now,
because it
we
will happen.
Yeah, and we still have our public health clinic,
In
which
the
is
clinic,
yes,
Little
which is
X.
for.
STIs.
There you go. You got
That's
it.
right.
So we'll do pregnancy tests also.
Mm-hmm.
That'll tie in with me and my prenatal program. We're gonna start doing those. But that's a walk-in clinic from usually around 8 to 5 Mondays and Fridays are by appointment. But you hit us Tuesday, Wednesday, or Thursday, and we'll be there. So we still have that. We still have some flu shots available. We're there for education. We're there for resources. So you never know if you don't ask. So come by and just ask us away, and we'll see if we can answer it.
Okay. Well, thank you guys for being here again.
Thank you.
Thank you for coming. And maybe we'll come back and do another one. And
Sure,
it sounds like you're busy, but come back when you have some more events. And thank you, guys, for keeping everyone healthy.
Oh, well, we try.
Thank you, guys.
Yeah.
We have an amazing team.
It's great to have you here.
Yeah. Well, thank you.
Thank you for listening. I'm Mindy Longhorn. We hope you join us next time as we talk among the Shawnee.
Nyawe, ye si hakueta wiani. Salanoki kenolepwa.